Open, outspoken, it's Ophthalmology Off the Grid, an honest look at controversial topics in the field. I'm Blake Williamson. Welcome to another episode of Ophthalmology Off the Grid. In this episode, my co-host Andy Corley and I are joined by Dr. Louis Probst, a renowned board-certified LASIK surgeon. We chat with Dr. Probst about his decision to ditch cataract surgery altogether and exclusively perform LASIK, how he manages patient expectations, and his tactics for working with unhappy patients. Coming up on Off the Grid.
Support for this podcast comes from Bryn Mawr Communications. BMC produces a number of informative podcast series spanning a variety of topics in ophthalmology. Discover a new show at itube.net/podcasts.
All right, and we are here for another episode of Ophthalmology Off the Grid with our special co-host, Andy Corley. Andy, how you doing, man?
Doing well, Blake. Good to see you again. Glad to have Dr. Probst with us today.
This is your third and final podcast with us, and I understand that you're never going to do a podcast ever again.
That is correct, Blake. It took me 10 years to do this one, and I'll never do another one, but thank you for the opportunity.
We've had a fantastic time over these past two podcasts, and it's really been great to have Andy, who's seen and done it all, and it's just been such a good time, so I appreciate it. Looking forward to our final episode. And our thoughts with this episode were, there's some people, I'm about 5-6 years out of residency, and there's some people that may not be household names to you when you're a resident, for those listening, but who in fact are some amongst the busiest surgeons in the country or the world. And these people, while they may still be very active, and teaching other surgeons, maybe they're not the ones that are on the podium all the time, or you're not seeing their faces and all of the magazines constantly, yet they're the ones out there doing a lot of the work. And so Andy and I were talking, and our guest today kept coming up in conversation.
That's right. That's Dr. Louis Probst. His name came up time and time again. And so I'll get the ball bouncing here, Blake. Lou, thanks for joining us today. It's a pleasure to have you with us. You are a LASIK surgeon. You don't do cataract surgery. Tell us about that. How'd you come to that decision? Are you happy with it now that there's a lot of refractive lens procedures going on? And tell us your view on how you got to be a LASIK-only surgeon.
Well, it's an interesting journey, Andy. I actually started off as a corneal surgeon, really. I did my fellowship with Ed Holland at the University of Minnesota, and Ed was and still is very cornea focused, as you all know. And when I went back, and I was Canadian. I still am Canadian, but I was living in Canada at that time. Went back to Canada and went back to the university where I did my training, and I went there as a corneal specialist. Started doing corneal transplants, and also did some cataracts. And at the same time, I had the chance to join Jeff Machat when he was starting TLC in the very first center, which was in Windsor, Ontario, and that was before FDA approval. And I noticed something very interesting in my practice. The most challenging procedure was a corneal transplant, and I took great pride in doing a beautiful corneal transplant. But I found those are my least happy patients. They'd come in, and I'd be marveling over what an incredible job I did, and they'd be thoroughly unimpressed and really disappointed that they had to wear contact lens or had some type of astigmatism. And so it just didn't seem that it wasn't as gratifying as I thought it would be, because the patients didn't seem to be that happy about it. Cataract surgery was more gratifying, actually. I could do a lot of cataracts. I could do those well, and the patients were very happy, and there's very few complications. But the big surprise for me was LASIK, because those patients were actually the happiest patients I had. And so, number one, I was really drawn to the high success rate of LASIK and the very high patient satisfaction rate and the very low complication rate that you can achieve with LASIK. And the other thing is that I really, very, very early on in my career, developed a very strong frustration and almost aversion to working within a hospital setting. because I found that it was just so inefficient. It was slowing me down in every way imaginable. Everywhere I turned, there was a reason why people thought I needed to be slower, that I couldn't do as much as I needed to do. I had no problem getting patients. I was always, right from the get-go, for whatever reason, I was always extremely busy. But it was so frustrating for me. And when I discovered that with LASIK, you could do it in a private clinic and control the environment, control the staffing, control the schedules. And these people are they're paid in a private environment, so they actually have to listen to you, as opposed to a hospital where you're not paying the nurses in many cases, and so they don't listen to you. And so I was really drawn to the efficiencies that were possible in a private clinic, and a private clinic was what really best suited for LASIK. So I started doing more and more LASIK, and after 5 years of practice, I just decided to go all in, and I've never looked back.
That's a great story. Now, that positive patient feedback combined with the inefficiency of running back and forth to the hospital just said, okay, I'm going to go where I can be most effective. I love that story. Have you ever regretted that or wanted to get back into lens surgery?
Well, only once. Only once did I have a pause, and that was in 2008 when the refractive market took a massive tank, when the whole economy tanked, of course, with the subprime mortgage crisis. And my volume was cut more than half. And I had, at the same time, had just built a massive house and had a huge amount of financial responsibility. And I started feeling kind of silly because my income, wasn't there anymore. And I started thinking maybe I should get back into cataract. So I did actually join or at least visit and partially join a very busy cataract practice near where I live in Michigan. And I know a lot of the surgeons there real well. And I worked with them and, went to their clinics and did do a few cataracts. But I quickly discovered that it just brought back all the same feelings I had, previously. Was, yes, this is successful. Yes, this is good. Yes, this helps a lot of people. But it just wasn't the formula I was looking for. I like the younger patients. I like the dynamic aspect of refractive surgery. I like the private aspect of refractive surgery, and I like the efficiencies of refractive surgery. So I tried it, and it just sort of vindicated my original decision to go purely refractive.
You still have that big house?
I'm sitting in it right now. Yeah.
Do you have a swimming pool?
No, we don't. My wife keeps telling me we should get
I was going
one.
to say, I wanted Blake and I to come over and go swimming, but I don't guess that's going to be part of the program today.
No.
Okay. All right. Well, listen, we'll keep moving then, because I want.
It's interesting that you say that about cataract versus LASIK, because I have found just the opposite in certain circumstances. Strangely, in the sense that I do a high volume of cataract surgery, and I do a fair amount. I probably do about of LASIK. I probably do maybe 40 eyes on a busy week, so probably half what you do. But that's still a fair amount of LASIK. And what's crazy is that oftentimes the expectations are so high with LASIK, it's almost a commodity, right? That I'll be sitting there and they're, I have a young patient, they're 20/15 in one eye, 20/20 in the other. And they're like, what's wrong with the 20/20 eye? It's like, it's almost like you don't really thank the pilot whenever they land the plane at your destination. You just get off the plane, right? So LASIK almost feels that way to me. They're very happy, don't get me wrong. And certainly the outcomes are better than cataract surgery for sure. But they expect to be. Whereas with cataracts, even though the expectations are climbing, at least they're older patients. At least they have poor vision ahead of time that's not as correctable with glasses and contacts. So for me, sometimes those are my happiest patients. My true happiest patients are my ICL patients. I don't know if you do any ICLs at all, but that's an interesting dynamic. So you found a way to kind of deal with the expectation management of younger millennials.
Yeah, I have, and really to be a successful refractive surgeon, as you know. You have to deal with that. I mean, that's part of the job, and having done this, as my sole focus for 20 years, you become a kind of a master of dealing with those situations. And that situation you've described, I've dealt with that, hundreds, maybe thousands of times. And, I know exactly what I'd say. I know exactly how I'd address it. Does it concern me? Does it cause me any, pause or any anxiety? What? No, I know exactly how to deal with that. But, like the interesting thing is that that's actually kind of what I like about it, because the bar is high. And I like that bar being high because that means I have to perform. I have to perform not just surgically, but I also have to perform in the way I interact with people, and I have to always be presenting that ultimate, that ultimate surgeon, who's going to instill confidence, but also have the patients be your friend and be someone they like and be personable. You have to do all of it to be a successful refractive surgeon, and I like that. I like the fact that it's challenging. I like the fact that I have to be all on all the time. I have to be on my A game. There's nothing less that will suffice. And to me, to me, I feel like I'm challenged and I'm using all my skills, and I enjoy that part of it. But yeah, I mean, I can see how some of these times. I mean, I have a lot of optometrists that work with me, and sometimes they'll come to me and they'll be say, "Oh my gosh, the patient in that room there, oh my gosh." But I walk in there, and within 1 minute, we're best friends. It takes me no time at all, because what what you need to do, and we know this as doctors, is you need to align yourself with that patient. As soon as that patient feels that you're somehow, diminishing their concerns, or you're not taking them seriously, you're not really concerned about them, then they start to get hostile or they start to get frustrated. But if you embrace them and you're like, tell me about this, I want to know about it, I want to know exactly what you're feeling and exactly what you're concerned about, and then I'm going to fix it. No matter what it takes, I'm going to fix it. I'm here for you. And as soon as they hear those words from you, all the tension's gone, and you're on board. So I like that part of it. To me, it comes with a job. I guess that'd be kind of like being a parent. The kids are great. Sometimes they're a challenge, but you take it all, because that's what comes with the package.
That is a very, very great overview. I think a lot of the audience for this podcast are younger and don't have a tremendous amount of experience in dealing with the unhappy patient. So Lou, if you could kind of give the young audience a 1, 2, 3 of how to deal with the unhappy patient, I think there would be people would really want to hear that.
Sure, I'm happy to do it. And I'll tell you, it's an art form. It is. I mean, it's not something that I don't think anyone's really born with. It's something you have to learn, and it's hard because your knee-jerk reaction when a patient is unhappy and is angry is to get defensive. That's what we do as human beings. If someone's kind of attacking you and saying, what did you do to me, and I'm not happy, then your knee-jerk reaction is to back off. But as soon as you do that, that gets the patient even more angry, because what they see there is that you're not accepting responsibility. And so that's the wrong thing to do. And so you have to do the exact opposite, and that is you embrace them. And so, I actually have given lectures on this. I know I'm a ghost now, but for 20 years I did. 20 years I spoke at every meeting that I was invited to, and so I did lots of talks on this, and some of them I talked about how you interact with patients, right down to the height of your exam chair. I'd like to have my chair lower than the patient so that I can affect the power dynamic. I'm a male. I'm already the surgeon. I don't need to be more dominant over my patients. So I try to equalize things to make them feel more comfortable. In terms of my body position, I always lean in when I'm talking to patients so that I look and feel and act engaged. And the other thing is, I never bring a chart in a room when I talk to a patient or type on a computer. Everything when I'm in the room with the patient is all about the patient. I look them straight in the eye the entire time I'm talking to them. And what I'm trying to show them is I care and I am fully engaged. So that's kind of a little bit of an overview. But in terms of a problem patient, I kind of have like 4 E's, and that I like to talk to my junior doctors about. And the first thing is to empathize, and that is to ask the patient about their situation, and then let them explain it without interrupting them. That's very hard for doctors to do. They're interrupting people all the time. Usually I think studies have shown it's, I don't know, within 10 seconds or 15 seconds, doctors interrupt their patients, but you just let them talk. And that alone is like half the battle, just letting them tell you what is actually wrong. And then you empathize with them, say, wow, so you're having problems with that must be tough. I mean, you're a nurse. You probably do have to drive at night, right? I mean, that's affecting your life, isn't it? And that alone is huge, empathizing with the patient and actually showing that you can show how that relates to their life. And the next thing is educations. And then so you sit back and you say, okay, now that you've explained this, let me explain how I think this might work and how I think this might be happening. And interestingly enough, those first two things probably has never happened before, because nobody even went that, down that road. So then you do that. And then the next thing is empowering them. And I empower them with short-term goals, and then empower them with long-term goals. So the first empowerment is a short-term goal. So the patient's upset. Obviously, they didn't get what they wanted. They're not functioning the way they want, and it's affected some part of their life. And so they're really distraught about this. And, it may not be a huge deal, but they're very focused on it. And so for them, it is a huge deal. Whatever it is, they've really decided that this is an issue. And so if you empower them and say, well, we can do this, and this, and this, and this, and this to help you right now, so you can drive at night, you can go to work, you can read up close, you can see better far away. And this will change that right away and fix it forever. So that you don't have to worry about it anymore at the present time. And so you're solving their problem initially. So then they relax because they're like, oh, I don't have to, hide away now because I know I can function. And then you start talking about long-term empowerment. Okay, now how are we going to handle this long-term so you don't have to worry about all these little things I just told you about? And so I kind of map out this plan. And then the final thing I always say to patients, and this is crucial, I really think it's a crucial thing, is I say to them, look, when we came into this procedure, I expected you to do perfectly, and most people do perfectly, and you didn't expect this to happen. I didn't expect this to happen, right? But here we are, and I understand what you're going through right now, but let me tell you something. I'm going to get you through this. I'm going to fix this, and I don't care how long it takes or how many visits I need to see you. I'm going to fix it. I'm not going to charge you any extra money for whatever I need to do, and you're going to be okay. That's what they want to hear. And that's what I do. And I do that. And when I finish that little sort of program, it might take 15 minutes. It might take 20 minutes. I have to, in my mind, kind of put the world on pause, because normally my clinics go much faster than that. But I know that this is going to take time, so I pause everything else. But once I'm done, that patient leaves there, and they're my friend. We are in this together. We're partners. The other thing I'll do is I'll give patients my personal cell phone number. I'll write it down on the back of my business card. And I'll say, listen, if you're worried about this, call me or text me anytime. I'm here for you. They never do.
You probably don't get any texts, yeah.
No, they never do.
Yeah.
But you know what? They are so happy to get that card. They are so happy to get it. Sometimes I'll get a text. It's actually funny. Like, I will actually occasionally get a text, and it'll be the most benign thing. They'll be like, I ran out of lubricating drops. Can you recommend a brand? And I don't think they're not really interested in the answer. What they're really kind of testing me. They're saying, like, is he really truly available? Like, I know he said he was, but is he? And then when I respond, within a few minutes and say, hey, I hope you're doing well and everything. And then that's it. But it's a huge challenge. But if anyone in the audience follows that program, I guarantee you, if you can do it, you'll be successful.
Yeah, I've done much of that, and the small amount of patients that are in that boat. And I agree with everything that you said. There's a lot of great pearls there, and oftentimes these people end up being your biggest proponents afterwards. They're a pain in the rear possibly for a few weeks, but at the end of that, you guys have a special bond, and they're actually your biggest promoters as opposed to being a detractor before. So, One of the things that you mentioned earlier is how much busy you were, how much busier you were, like on the speaking circuit and doing all the meetings and stuff, earlier in life. Not exactly a ghost of ophthalmology at all. You've written several textbooks. You've done over 120,000 LASIK procedures. Looking at your CV, obviously, you're extremely visible surgeon. But you're mentioning that these days you don't feel like you have to go to every single one or be at every single meeting. When did you kind of decide that? And did family? I know you have 3 kiddos. Like I have 3 kids as well, and I'm kind of going through that now to a degree, and I'm only 5 years out. So how did you kind of decide to take a step back and maybe concentrate more on business or family or other personal things?
Well, Blake, it's a lot of things happened, which kind of came together. I was all in for about 20 years. I would go to every meeting I could go to. If I went to Oscars, I'd stay like almost the whole meeting. And sometimes I'd have several talks every single day. And I loved it. I loved talking. I love interacting with all the colleagues. I learned a lot. But things changed. First of all, there was a period of time when LASIK was the thing. Everybody wanted to talk about LASIK. Everyone wanted to learn about LASIK. In fact, when back in the early 2000s, when we would do LASIK symposiums or lectures, they were so popular that the whole auditorium would fill up, and then they'd have to put monitors in the hall, because to accommodate all the people, and there would be people sitting in the aisles. That's how popular the LASIK was. Well, that's changed now, of course. There's really very few lectures at Oscars on LASIK specifically. There's something, sort of variations of LASIK, but really people want to hear about cataract surgery. They want to hear about specialty cataract surgery. They might want to hear about cross-linking. They might want to hear about a smile procedure. But in terms of really focused meetings on the nitty-gritty of LASIK, those days seem to have kind of come and gone. So number one, it didn't seem like there was really the audience for what I'm focused on, which is the absolute minutia of LASIK. I'm obsessed with one procedure and all the details of that procedure. So that was the first thing. The other thing is the whole environment changed. There used to be at the meetings all these user meetings and a lot of company-sponsored activities. And then, times have changed, and as the regulations changed, all those meetings have kind of gone away. And so they're really, again, that affected the focus on LASIK. So those are some of the things. And then also my life changed. And you were mentioning your children and obviously your family and your wife. Well, my kids are all teenagers now, and they're in high school. They're doing high school sports. They're getting they got their driver's licenses. They're getting their orthodontics. They're doing their SAT tests. They're applying to colleges. There's a lot going on in my family. And for 20 years, or no, maybe 15 years, my wife really put her career on pause to allow me to just, be as ambitious as I could be. And, I'm very grateful for her for doing that. But, she's a radiologist, and she specializes in breast cancer and in breast radiology. And she, decided after 15 years that she wanted to get back into it and pursue her own ambitions, go to her own meetings, make her own contribution to her specialty. And I really didn't have a problem with that. I thought that was completely fair. She'd gone 50% for 15 years, really, for the family and for me. And so she wanted to pursue her career. So I was really, after all these years of meetings and flying around and surgery and busy all the time, I was really happy to spend more time with my family while she was, going off blazing her own path in her own career. And so it's kind of interesting. It's kind of like a tag team thing. I did my thing, and I'm still doing a lot of procedures, but I kind of, in terms of the meetings, I felt like I don't really need that anymore. And, for my wife, I was like, honey, you go for it. You just, and she's having a great time, and it's awesome. And, she'll tell me I'm flying here and I'm going to China to do this, and I'm going here to do this. And I'm like, go for it. It's not what I want to do, but if you want to do that, that's great. I'll stay home and drive the kids to swim practice.
And are you every bit as fulfilled now, or even happier now than you were when you were flying around doing all that stuff? Because I talked to some KOLs, and they're like, oh man, you're going to miss it if you get off the podium or stop doing this. I'm like, I don't know. I don't think I would necessarily.
I've never thought of it that way at all. I think you pick your path, and then you just do the best job you can with that path. So when I was doing the lectures, I always tried to do the best job I could with the lectures. I always tried to put a lot of thought into it and tried to hopefully contribute something new and inspire some new ideas. And now, I try to be the best father I can be, right? I mean, I'm talking to my kids all the time. I mean, my oldest son is heading off to the University of Michigan in like 4 days. And, there's a lot of things I want to tell him that he, needs to think about and be careful of when he's, off from college, because, he's leaving the nest, he's launching. And so I'm doing the best job I can with that. And, for instance, today, he and I took a Uber car to lunch and then Uber back, but I made him, put it on his phone. So he did the Uber there. He did the Uber back because I said, listen, if you're at college and you need to get around, you need to know how to do Uber and Lyft and all that stuff. And I don't want you to feel like you're trapped. And I want, you to be empowered with that. I know it's a simple little thing, but, now I feel my job is to, support them, do the best job I can at that. I don't have a problem with not lecturing. I have another challenge that's probably, more challenging and in some ways more fulfilling. At least I can directly see the results of these things.
Well, I think this has been a great session. And I just want to thank you, Lou, for sharing part of you with us today. I certainly don't want to suggest that you were a ghost. Anything but we've missed you, and we're just glad to catch up, and it's good to see you, and I'm glad you're fulfilled. And I think that'll do it for today. Blake, you got anything else?
Man, I appreciate it. We learned a lot. I mean, this is someone who's doing, 100 surgeries or more a week at times. And, numbers like that, hundreds of thousands of surgeries, or thing that people are just getting out and training right now. It's just mind-boggling to some of us. It's just impressive to talk to someone who can do that, but also hear about their personal life and hear about that balance and the fact that they're still happy as can be 20 plus years later. So, Dr. Probst, we appreciate you talking to us and look forward to having you come on the show again sometime.
Thank you to Dr. Probst for joining us on this episode of Ophthalmology Off the Grid. And thank you to our listeners for tuning in. This has been Ophthalmology Off the Grid. Until next time.